thank you, ma'am, for this opportunity. And I'm also learning with all the participants, and it is because scientific writing and it's a continuous process, and we all learn together in this process. So the topic that was assigned to me was CONSORT Statement and other reporting guidelines. I have seen that yesterday Dr. Piyush was showing you the equators network and other things. So we'll also try to cover that part, and we'll see how it goes, right? So the plan of the session, what I'm intending to cover in this 45 minutes or 50 minutes or so, is we'll talk about why it is important to have a reporting guideline. And we'll also talk in details about the CONSORT statement and some other guidelines through the Equator network. There are multiple guidelines available for all types of study designs, and we'll try to look at those components. To start with, disclaimer: the materials presented in these sessions are from all available in the website, mostly taken from the consortstatement.org and equatornetwork.org website. So these are the two very, very valuable resource sites where we can go and learn a lot of things. How to present or report our manuscript as per the study designs that we are trying to do. So to start with, what is a reporting guideline? Why you are so interested to know about reporting guideline? So reporting guideline is basically a structured tool for health researchers to use while writing manuscript. So this assists us in or adds to tell you the points, what are the points that are there in the manuscript that should be to make it complete, and we should not leave out any points that are required to be presented to the group. So a reporting guideline ensures a manuscript is understood by a reader, it can be replicated by a researcher, used by a doctor to make a clinical decision if it is properly done, and included in a systematic review. So the basic thing why we do research and research paper when we read, we get to know is how this study was done. So basically the method section, the way that it has been written, whether someone can replicate it or not, and based on the objective methods, whether the results are appropriately presented and it is making any sense or not. So these are the best thing that why the reporting guidelines are there. So to assist us in reporting our manuscript in a complete, clear, and transparent manner. So is there any evidence of poor reporting? Are we really interested, or as doctors or as researchers, don't we know this? So if you look at the published literature, many published articles omit vital information, and it has been presented in all our scientific journals in 2010-12. When we look at the randomization part in an RCT is very, in 50% of cases, it was not properly mentioned. There were issues about blinding, sequence allocation, how it was done, because randomization is heart of the RCT, and if it is not properly done, then selection bias creeps in, and that leads to a faulty result that is coming out of it. So the second part is it is difficult to understand how the research was done. That means the method section was not properly presented. People do not know how have you done this particular study unless it was reported clearly. Sometimes there is misleading interpretation available in this. People highlight something else that what they have not done. The other thing is selective reporting of methods or findings. So as we all know, we are biased towards p-value of less than 0.05. If we find something which is less than 0.05 p-value, we tend to over-report it. As in the previous sessions, we also learned that if we try to use statistics more often, multiple tests were done, then some things will come out significant. So our primary objective, the primary objective that we are trying to establish through our research, we should present it very clearly. Even if it is not significant, it's all right. But what happens is we are biased towards p-value of less than 0.05, and we tend to over-report it. And that is also the publication bias also goes in that direction. So there is, and this type of mistakes are not limited to RCTs alone, but it is generic across all biomedical research designs. So that is why. But we are very concerned about the RCTs. Why we should be very, very careful about RCT reporting? Because whole of medicine depends upon the transparent reporting of clinical trials. We know that a well-designed and properly executed RCTs provide reliable evidence for decision making. And as if you look at the evidence hierarchy of evidence, the RCTs, the randomized controlled trials, systematic reviews, and meta-analysis, it occupies the top of the pyramid because it provides the strongest evidence or robust evidence from the scientific inquiry. If you look at expert opinion, case reports, case control studies, or observational studies, it comes down. So that is why we should be very, very careful about how do we report our RCTs. Biased results from poorly designed and reported trials can mislead decision making in healthcare at all levels. It can mislead the policymaker. It can also, as a clinician, it will be difficult for us to take a proper decision. And because the trials are not properly reported, the risk of bias is more in that. What will happen when we do systematic review and meta-analysis? There will be a lot of uncertainties around that. That is why we should focus on how do we properly report the RCTs, and RCT reporting is of utmost importance. So from where we can get help from reporting RCTs and other things? We had an opportunity to look at Equator Network yesterday. So if you go to this website, www.equatornetwork.org, we'll see that we have got a lot of reporting guidelines available. It is almost for more than 250 studies, there are 454 reporting guidelines available, starting from randomized controlled trials, observational studies, systematic reviews, you name it, you will find the reporting guideline here. And this Equator stands for enhancing the quality and transparency of health research. So this is why this website is very useful for all the researchers, may it be young or seasoned or experienced one. We always go back to this particular website to look at what we have missed and how to report our manuscript. And it is a very useful tool. So you can always go back to this particular website and refer, and you will find one guideline for one study design at least. Now let's come back to CONSORT statement. How did CONSORT come into existence? So if you look at the literature in 1993, a group of editorial members, they were perturbed by the way the RCTs were reported. So there are two independent groups that came together. They were thinking about the same issue. How can we improve the reporting of RCTs? And in 1993, a new scale was developed to assess the quality of RCT. At that time, they were looking at the quality of RCTs, and standardized reporting of trial or SORT statement came into existence. Because there were two groups working together, the editorial editor of JAMA, they thought that let's put it together and have one particular guideline. Otherwise, what will happen? It will lead to a lot of confusion. So in 1996, the CONSORT statement, the two groups who were working separately were brought together, and CONSORT statement, which stands for Consolidated Standards of Reporting Trials, came into existence. So after 5 years of this CONSORT, it was revised, and CONSORT 2001 statement, which included a checklist and a flow diagram, were presented in the scientific community. Then this is another interesting thing. The CONSORT explanation and elaboration article gives you the details of each and every point that is mentioned in the checklist. A very, very interesting read. So I encourage all of you to go through and read this to understand each and every topic of what is mentioned in the checklist. And after 6 years, in 2007, there was again a revision which was published in 2010, and currently we are using this updated CONSORT 2010 statement, which consists of 25-item checklist and a flow diagram. They also tried to tell us about CONSORT 2010 explanation and elaboration document, and there was something called CONSORT extension. Why CONSORT extension came into existence? Because the original CONSORT was targeted towards most common design type, that was individually randomized, two group and parallel arm studies. So when there is deviation from this particular design, the CONSORT extension were there to help you out. So what are the CONSORT extensions? What are the study designs that we look at that? Cluster randomized, non-inferiority trial, equivalence trial, non-pharmacological treatments, herbal treatment. There are so many other parts of the CONSORT treatment is the deviation from the two group individually randomized and parallel design are available, and for that we have something called CONSORT extension. Now, what are the objectives of CONSORT statement? What is it that it tells you to do? So this is an evidence-based minimum set of recommendations, including a checklist and flow of diagram for reporting of RCTs. It helps authors to assist authors in providing guidance to improve the reporting of trials. It helps us to make our manuscript clear, complete and transparent manuscript preparation, and it indirectly helps us to give us pointers towards design and conduct of related issues. So this CONSORT statement, actually people use it at the end, but when we plan a study, it is a good practice to look at this CONSORT statement and try to see if we have covered all the points there or not. Because at the end, there will be some points which will not be able to address. So when in our proposal development or protocol development stage, if we use CONSORT, it will help us to think about all the other points that we may have missed in designing our study. So the second point, why it is helpful for the readers, peer reviewers and editors, is also to look at, critically appraise and interpret the reports of RCTs. So these are the things that why the objectives of CONSORT statement came. Please remember, it was there to help the authors for completion, for reporting, not for. We'll talk about what it doesn't recommend. The first one is, it doesn't give you any recommendations on how should you design a study, how do you conduct it, and how do you analyze it. It asks you questions that how you have done it, but it will not tell whether it is right or wrong. For that, you have to plan the study in consultation with various stakeholders, look at the methodologies part of randomized control trial. There are other techniques available for assessment of quality. So it's not a quality assessment tool. Some people have tried to make it as a quality assessment tool. So you cannot, what CONSORT recommends is, you cannot create a quality assessment index and then try to see whether it is good. So it is basically helps us in reporting of what was done and what was found. So this is what is the bottom line that we must remember. CONSORT statement is a reporting guideline. Now, what are the components of CONSORT statement? Basically, as we have already discussed earlier, there are two components. The first one is then second, the checklist, which has got 25 items. Is there any other question? Is there any doubts or something? Then we can always take the questions. All right. So, if you are not speaking, it will be helpful if you could mute your mic. All right. So, CONSORT flow diagram and CONSORT checklist. So, if you look at the flow diagram, it's a beautiful way of how to enroll our participants. How do you allocate them?
Rohit, kindly switch off your, kindly mute your phone. Rohit. Rohit, kindly mute your phone.
Thank you for that. All right. So what we are discussing here, the CONSORT flow diagram. The CONSORT flow diagram has got 4 major components. It talks about enrollment of participants. So after assessing the eligibility, okay. So
So we are not able to understand. There is a lot of disturbance. We're not able to understand.
yeah, can you hear it clearly now?
Now we can hear, sir, in between those disturbances.
Yeah, if the participants please mute their mic, it will be very helpful. Thank you. Okay, so now let's talk about components. We'll start again from the components of CONSORT statement. It has got 2 components. The first one is the flow diagram and second is the checklist. You can take it in any order. People tell that the checklist should come first and the flow diagram, it doesn't matter. It has both included in the same thing. So if you look at the CONSORT flow diagram, what happens is it tells us or it guides us in thinking about how do we enroll our participants after assessing their eligibility. So after eligibility assessment, we randomize them into 2 groups, the allocated to intervention. So first one is enrollment phase, then allocation to intervention group, then go to the follow-up. When you give them intervention, there will be a period of follow-up. Then how did you do the follow-up? How many participants who are allocated to intervention were lost to follow-up and discontinued intervention? That number we should present in this particular box. Then finally, we look at the analysis, how many were excluded from the analysis and why they are excluded from their analysis. So the CONSORT flow diagram, now you will see in all RCTs, this is a diagram that is always will be available for summary of your eligibility and the candidate enrollment, participant enrollment, allocation, follow-up and analysis. Now the next part is CONSORT checklist. It is a 25 item checklist. This is too crowded, but we'll go slow one by one in the subsequent slides. But there are certain sections that we should remember in this checklist. There are particularly 6 sections. The first one, it starts with title and abstract, how it should be reported, what should be there in the introduction, what methodologies are followed about trial design, participants, randomization, and blinding. All other things will be mentioned there. The result section, what are the things that should be present in the result section. Discussion, how we should write discussion. We have sessions on discussion writing previously. The same principles are followed, but it tells you in a checklist that whether these points were represented in your manuscript or not. And finally, some other information regarding registration, protocol, and funding. So these are the things that the CONSORT checklist asks you to look at that. And then when we'll look at a study and try to apply this CONSORT checklist to this particular study and see what is missing and what is there in this particular study. So we know about this study very clearly. Remdesivir in adults with severe COVID-19, a randomized, double-blind, placebo-controlled, multi-center trial. This study was published in the Lancet in the May 2020 issue. I am sure it is a very straightforward, and a lot of interest was generated when it was published. A lot of debate happened after that, whether it should be included in your treatment protocol or not. So now let's look at this, taking this as an example. We'll try to apply the CONSORT checklist to this particular study and learn what points are missing or what points are there in this particular issue. Now, first thing is the title. So the background of the study goes like this. So this is a randomized, double-blind, placebo-controlled, multi-center trial where the Yeah, sorry. So it's a double-blind trial to assess the effectiveness and safety of intravenous remdesivir in adults more than 18 years of age admitted to hospital with severe COVID-19. The trial was done in 10 hospitals of Wuhan, city of Hubei province in China, and then they have presented their finding, how it was, what were the issues that were there in this particular trial, or the results that we are going to look at. So the first thing is, if you look at title, what it recommends in the CONSORT statement is identification as a randomized controlled trial in the title. So in this particular study, they have very clearly mentioned a randomized double-blind placebo-controlled multi-center trial. So next component is we look at the abstract. Now currently CONSORT has got a checklist for abstract also to develop. So this is the abstract that is present in there in the website. I circulated that paper yesterday to the group. Probably if you can go back and again apply this CONSORT statement after our discussion, it will make things more clear. So it has got some components on summary, methods, findings, interpretation, and funding. So if you start looking at the checklist and try to see what components it is asking for us, the first component is trial design. In the method section, it mentions we did a randomized double-blind placebo-controlled multi-center trial at 10 hospitals in Hubei and China. So that component is very clearly mentioned. Following this, the study design is also incorporated into that, the study setting where it was done. The objective of the study was to look at the primary endpoints, were to look at the safety and efficacy of this particular study. The primary endpoints considered was clinical improvement up to day 28, and that was defined as the time in days from randomization to the point of a decline of 2 levels on a 6-point ordinal scale, which is mentioned in the next line. So they have also talked about the participants' eligibility criteria, who are included in this study: adults of more than 18 years, admitted to hospital with lab-confirmed SARS-CoV-2 infection, with an interval from symptoms onset to enrollment of within 12 days. Then how they were randomized, that is also mentioned. So the randomization was done, randomly assigned in 2:1 ratio to the intravenous remdesivir group and the same volume of placebo infusion for 10 days. So that is what the regimen is also mentioned: 200 milligram on day 1, then 100 milligram on day 2 to day 10 on a single daily infusion basis. After this, the trial registration number is also mentioned in the clinicaltrial.gov site. Following this, the outcome was properly presented in the finding section, where remdesivir use was not associated with a difference in time to clinical improvement. The hazard ratio with 95% confidence interval is also mentioned. So some harms, discussion about harms are also presented in the abstract section. The conclusion is clearly told in the interpretation section. Then the source of funding, who funded this study, is also present. Then the details about the corresponding authors are mentioned in this particular abstract. So if we look at CONSORT abstract checklist, it has got the same items. It is the title, the author's contact details, trial design, and under method section, what are the things that we should cover. Under result section, what what is the information that we should present, and in the conclusion and trial register. So CONSORT abstract, because abstracts are the most read component of a, after title is the of a manuscript, we should be very, very careful in making our abstract neat, clear, concise, and giving enough information for the reader to go back and look at the full paper. So now let's look at the introduction. I have taken the screenshots and put it here. In the introduction, you usually talk about the scientific background and explanation of why this study is being done with specific objectives or hypothesis. So in this particular paper, they have talked about how COVID-19 started, sorry, that should be hyphen there after COVID-19. Then the background on remdesivir, how it is, what type of drug it is, whether it has been earlier proven to be effective against such viruses, and in vitro, what is the effect of this particular drug on SARS and the other MERS coronavirus infection. So they have all nicely put it there. Then they are coming to tell us that why this study was created, instituted to look at the benefits of severely ill patients with COVID-19. However, the clinical and the antiviral efficacy of remdesivir in COVID-19 remains to be established. And that is how the objectives, the last part of that paragraph says the specific objective of this study. So introduction is complete. The methods section, when we look at it, it will have trial design and details about the participants, description of trial design, allocation ratio. If we look at the trial design, the study design is mentioned in the first line. Then inclusion criteria, who are the people included in the study, who are the people who are excluded also is there in the next paragraph. CONSORT statement now tells you to put the allocation ratio very clearly in your randomization details, where eligible patients were randomly assigned in the 2:1 group, the remdesivir group and the placebo group. Why 2:1? Because they have stratified the severity of the condition who are admitted. They were divided into two groups. We'll look at when we talk about the randomization details in the next slide. And then there was where the protocol is published online, that also you have to give an information in the methods section. Then in this group, in this section, we look at the intervention, outcomes, and sample size. So the outcomes and sample size were all clearly mentioned. They are talking about the primary clinical endpoints, and also talk about the secondary clinical endpoint. The intervention is intravenous remdesivir 200 milligram. The regimen is completely given there, and it was compared against the placebo infusion for a total of 10 days. What is the primary outcome they are studying is also mentioned very clearly. Following this, the secondary outcome, then the sample size calculation. It is actually, if you look at sometimes they may not be in an order that is given in the CONSORT statement, but all these items are available in the paper to study and to look at it. So sample size was given under statistical analysis section, where they have told how the sample size was calculated, how many events were they were expecting to study in this group, and how they could not complete the study, and at 240 patients they had to stop it instead of the total recruitment of 325. Then there in the method section, there was also discussion about randomization and blinding. How the randomization component is very, very important in an RCT. We should be very careful how we have done this process, and CONSORT gives very specific pointers to mention that in our manuscript. The first point it tells is how the the allocation random sequence was generated. So under the randomization sequence, allocation sequence generation, allocation concealment, and the implementation of randomization was how it was done. It has to be very, very clearly mentioned because 50% of the RCTs around 2012 to 2015, they didn't report these things very clearly. So we should be very, very clear in presenting this type of information to the reader, so that at least the reader will know whether it was appropriately done or not. Then after randomization and allocation concealment and all those processes they have done, they have mentioned their permitted block of randomization 30 patients per block, because in the 2:1 ratio of allocation sequence, the patient COVID-19 hospitalized patients were stratified into two arms, where their oxygen requirement on the basis of oxygen requirement. So mild cases, or the moderate cases, less than the oxygen requirement, if it is less than 94%, something they have mentioned in the group. And if their ECMO and other things were being done, they were severe cases, they were divided into 1:1:1 or 2:10 were given, one ratio, and in the block size of 30, 10, 10, and 10, 10 went for the plus 20 went for the intervention group. So, and then the plan of analysis, whether it was intention to treat or per protocol analysis was also mentioned. Here they have mentioned the primary efficacy analysis was done as intention to treat. And then finally the outcome was also mentioned. So if that concludes our method section. So there is a lot of pointers. You don't have to remember these points, but at least when we review something or we start writing, if we have the CONSORT statement in front of us, it helps us. It tells us that what points we should include in our manuscript. So the result section, the participant flow and recruitment. If you look, we have already discussed about the flow diagram. 255 participants were screened, 237 were enrolled, and 158 were assigned to remdesivir group or intervention group. 79 were assigned to the placebo group. Then, as it was in the group, it was mentioned that during the follow-up component, how many were they didn't complete the study. That has to be mentioned with reasons. And finally, how many completed the study and what was the number that we are dealing with. Because the type of analysis differs in the RCT, as we already discussed, that intention to treat and per protocol analysis takes different numbers during our discussion. So the result section should also tell us about the baseline data. There is a table that usually it is customary to give the tables where the baseline, the control group and intervention group is compared, the baseline characteristics, how it is, whether they are similar or different, that has to be mentioned. The outcomes should be presented, the effect measures with precision, that is 95% confidence interval. Here the primary outcome they are looking at is time to clinical improvement, and it is time to event analysis. So hazard ratio is considered, the 21 days versus 23 days. So there was no significant difference in the control or intervention group in this particular thing. Then they also have mentioned about per protocol. It's a good practice to give intention to treat analysis and per protocol analysis, both the things, so that people can choose what they want to take it from there. So 28 days mortality, there are other secondary parameters were also analyzed, and that was also presented. The result section also encourages the authors to talk about the adverse events and the harms that were there in this particular RCT. Any secondary analysis that was done or subgroup analysis that they have done, it should be included in this particular section. The discussion component, we have already had a session on this, how to write discussion and other things. So the major things that should be included in the discussion portion as per the CONSORT checklist is to talk about limitation, generalizability of our study result, and interpretation. So this was all clearly done. The limitation of the study they have clearly mentioned include insufficient power to detect assumed difference, because they had to stop the trial in between because of various other reasons, and how it can be generalizable. What are the, because generalizability is linked to the external validity of the study, the way the patients were selected. So that is how that component will also be discussed. And finally, the summary interpretation. So the remdesivir was adequately tolerated, but did not provide significant clinical or antiviral effects in seriously ill patients with COVID-19 disease. Following this, the last part of the CONSORT statement also talks about providing other information in the manuscript, where we should talk about registration number, then the protocol, where protocol can be available, full trial protocol, so that if there is any deviation of the protocol can also be compared, and the source of funding, who are the people who funded this particular study, that should also be mentioned very, very clearly in the study. So finally, this is how it looks. It looks cumbersome. There are 25 items here. But if you start doing it bit one after the other, it's a very nice experience, and it also helps us to learn and remember things very, very clearly. As of till now, whenever I do review or I try to look at such type of papers, RCT, I always take a printout and keep it with me so that I don't forget any other points. So we don't have to remember this, but we should know that this checklist is available and we should follow it for looking for the reporting, whether it is complete or not. So we'll stop our consorts discussion here. The topic also says that we should talk about some other reporting guidelines. I'll just take another 2 to 5 minutes maximum to talk about this. If we go to the Equator network, we had seen it earlier that there are so many other guidelines are available. We talked about CONSORT here in the middle. So it is a framework that moves from one end to the other. Was the research on humans? It is yes. Did your research generate quantitative data? If it is yes, did you combine and analyze review result of previous studies? If you say no, if it is yes, then it goes for PRISMA, the systematic review group. Then if it is no, then was your study a randomized trial comparing 2 or more health intervention? Here it is CONSORT. If it was not randomized or it was an observational design, did your study explore the relationship between exposure to risk or protective factor or outcomes? Then it is we use the STROBE checklist, which is for the observational studies. There are there are so many other things starred for the diagnostic test and so things. So please go to this website and try to have a look at it. What is available in this website? It takes a lot of time to look at this and read, but everything is available online, and this is a beautiful compilation of all the checklists in the Equator network. STROBE checklist, let me tell about 1 or 2 points about that, because there will be people who will be interested to do cross-sectional studies here. So it follows the similar pattern of looking at title and abstract, STROBE introduction, methods. So under method section, how do you talk about study design, setting, participants, variables? Everything is there in this. Following that, we'll look at the results part, then discussion and other information like funding. So keep it with you if you're planning to do a study. It is, though it says that we should look at for reporting, but in your planning of your study also, it can help you to look at these points, and it will definitely improve the way that you plan your studies. So equatornetwork.org, as I have already told in the previous slide, it is available there. So please feel free to visit that site and take the appropriate guideline that you are as per your study design that you are planning to conduct. I'll stop here. If there are certain questions, anything that is required, we can always discuss.